executive director of Food Share for 25 years, where she helped launch programs such as the Good Food Markets that helped establish community-run pop-up fruit and vegetable markets in low-income communities. Currently, she is the coordinator of the Coalition for Healthy School Food, a national network of nonprofit organizations. Both these speakers exemplify the importance of collaborative partnerships that provide us an incredible display of community solidarity and resilience in times of crisis and beyond. Please feel free to explore their communities' pages whenever you have a chance. Responding to our roundtable speakers is our valued food and health academic collaborator, Assistant Professor Sarah Elton from X University. She directs its Food Health Ecosystems Lab and is also the author of award-winning books such as Locavore, From Farmers' Fields to Rooftop Gardens. We are also proud to say that she is a former graduate fellow of the UTSC Culinaria Research Center and is affiliate faculty at the University of Toronto's Dalalana School of Public Health. Supporting this event are Kim Choi and Lee Slinger's teams, but also our wonderful food and health undergraduate student researchers, Matilda DePieri and Veronica Waba. Veronica is also a liaison with the Scarborough Food Network, whose community advocates will join the roundtable in the second hour and include noted advocates such as Ilham Saidna and Tinashi Kanangoni. As this event proceeds, we invite you, the audience, to join us in a virtual chat session for relevant questions and comments, especially as directed to any of our speakers. Suman, can I invite you to start, please? Thank you.
Thank you very much, Professor Sharma. This is great. Great introduction. I think I'm going to spend a little bit of time talking about Scarborough Food Security Initiative, how we were born, and because that's very relevant on the topic that we are talking today. Scarborough Food Security Initiative, also known as Feed Scarborough, was born out of the pandemic in 2020. In March, when in Scarborough Southwest, the only food bank, the Bluffs Food Bank, closed their door due to pandemic, it was a group of community members who came together and took it upon themselves to actually try to figure out how to get food to people. I still remember the first day we put some money on a table, walked up to No Frills, bought some groceries and said, let's give it to some people. And we put a call out saying in Scarborough, who needs access to food and is going through a tough time? And within the next 24 hours, we had over 1,000 families reach out asking for food help. We quickly realized putting some money on a table, walking up to the grocery store is not going to cut it. And I think that says a lot about the food insecurity that is in Scarborough. And as I'm going to talk, I'm going to get to it a little more. So right after that, we reached out to our partners in Daily Bread Food Bank, Second Harvest, Food Share. They all jumped to support us. We got food. We started delivering food to 1,000 families every week. And we did that for around 3 months. And then when summer, things were starting to open back up, we lost a lot of volunteers because they were going back to work. So we started food banks. And right now, I know Professor Sharma mentioned 4 food banks. Just last week, we opened our 5th food bank. And right now we run 5 food banks in South Scarborough, from Victoria Park all the way to the Pickering border. But one thing that's really very interesting, and our food banks are very innovative, and I call it innovative because unfortunately, we didn't have a choice but to be innovative. Like most of the food banks at that time, they were handing out bags and boxes of food to whoever comes to the door. But think about it this way. If you walk into No Frills or Loblaws or Sobeys today, and the manager standing there gives you a bag of food and say, okay, take this and feed your family this week, how would you feel? I came as an immigrant to this country with $42 in my pocket 20 years ago, and I accessed food banks. They gave me a box of stuffing, and I looked at it, and I said, why are you giving me dry pieces of bread? That makes no sense, and I threw it in the garbage. Because I didn't know what to do with it. I came from India. Stuffing is not a part of our culture, period. But you give me a can of chickpeas, I know exactly how to feed myself. So we thought about these things and we created our food bank, the grocery store model, though that is not brand new. There were other agencies who were doing a grocery store model, but we took a step forward. We had a system where we have our own version of a points card where everybody, when they come, they get points. They go shopping throughout our food banks, whatever they want, and they pay with that points card. If they have points left over on their card, they take it home, and next time when they come, they have additional points to spend. And the primary reason being because we saw the first couple of weeks of the month, the demand was slightly lower than the third or the fourth week of the month. And our clients were grabbing the food as much as they could the first and second week because they didn't want to lose out on it. But this way, with our program, they actually could budget and plan. They didn't have to stockpile in their home what they didn't need just because they're going to lose it. They could get what they want. If they have their child's birthday party on the third week, then the third week they take a little more food. And first 2 weeks they take a little less. So they had that whole freedom and dignity of planning. And of course, with COVID, everybody was worried that our food banks were open, people were coming in, shopping, and there were lineups because we were letting little amount of people at a time. So we went one step forward. We created online food bank, where just like imagine you going into Walmart or Loblaws and actually placing an order and then going and picking up. That is exactly how our food bank is. You go online, put in your order, you choose exactly what you want, and then you just come pick up and go. So this was really very interesting. We did it just to combat the COVID and the long lineups. But what happened was something that we did not believe would happen, and it did. We had at least 70% of the clients who use our online food bank were first-time food bank users. They are the people who stay with food insecurity, but do not want the stigma of standing in front in a line of a food bank. But they were suffering. And that says miles about Scarborough and the community here on the East End. Though, and it's a lot to do with the culture as well. We know the strong immigrant domination in Scarborough. There is a huge percentage of first-generation immigrating into Scarborough. And growing up, I can tell you this, my parents would go hungry than to go to a food bank. It's not in our culture. And people of this nature were actually suffering without proper access to food, but they didn't want to go and stand in a line of a food bank. And I think that is really important to talk about because when we see data, when we see numbers, we see research, what we really see is what people identifying themselves as food insecure. What is going unseen is the tremendous amount of people who are suffering, but they don't even realize they're food insecure. And I think that is very important, and we see that a lot. So that happened. And I think the other important part for me to mention is our brand new food bank that opened last week. One of the things of late that we have seen tremendously in our communities is we call it the working poor. People have a job or two, but still cannot afford the regular living in the city. By the time they pay their rent, their transit, they do not have enough money to buy food. And having a food bank that was open in the middle of the week, in the middle of the day for 2 to 3 hours just wasn't cutting it because this demographics that is growing was not having access to proper food. So this new food bank we opened, it's a Tuesday to Saturday, 5 days a week, 8-hour days food bank starting from late morning till early evening. So most of the people who's doing a shift work or going to school can still access our food bank. It is without appointments. You walk in, you just go shopping, and you leave. So this food bank that we opened not only because we wanted to serve our community that was in very much a need, but it was a very good place for us to start an advocacy campaign, to have our elected official understand the need that food security or access, food insecurity is not a food issue in Canada. It is everything else other than food issue, like income, poverty, transit, all of this, and lack of proper employment and housing. So there's a lot more to food insecurity. I strongly believe food security is a byproduct of all these problems. When we see people trying to put a roof above their head, trying to pay for transit so they can get to work, and all these, whatever little money is left, finally they spend on food. That's where they cut. And that is affecting us. That is affecting us tremendously, because we know from government documents that year over year, our healthcare costs are going up. And 20, 30 years later, it'll go even higher and higher and higher. And why is that? The governments are always taking a step forward to try to fund the healthcare when the food care, which is the starting of a good health, is often neglected. We see from governments, whenever we talk about food security, any level of government, I'm not being putting a finger on one color, the first thing they think is, okay, let's give some money to the food banks. That's not food security. That is certainly they're buying more Band-Aids for us to keep putting Band-Aids on the wound, but none of them is actually investing in fixing the wound. They're not investing in other ways, like for housing, the employment and all of this, so food security can be better. And that is what we in Scarborough are advocating for heavily, because we strongly believe that we need the government will, the policies to change, to actually support everything around poverty and actually fund poverty reduction strategies in municipal, provincial, and federal levels to actually affect food security in our community. So I'm going to leave it at there, Professor Sharma, and any questions?
Thank you. We had Suman Roy with his powerful advocacy of where food fits into the broader picture and where we can actually proceed from food security to nutritional security, poverty reduction. And from we invite Debbie Field now, the national coordinator of the Coalition for Healthy School Foods, to lend her voice and that of her network to this roundtable. Thank you.
Great. Well, I'm going to share one of the only good news stories that we've had in the food movement in a really long time, which is after many, many decades of advocacy in Canada, for the first time ever in December, we had the inclusion of school food in 2 mandate letters federally. So it's a bit of a shift in conversation. I mean, Suman has brought us to the very real suffering caused by COVID and the increased immediate hunger, and, you know, of course, provided the solutions that we need around income security. This is a different piece of the puzzle. This is the piece of how children eat or don't eat healthy food at school. And for many of us, it's about children of all income levels needing access to good, healthy school food. So Canada, for a variety of complex jurisdictional reasons, has been one of the only countries in the world, the only G7 country without a harmonized federal school food program, and one of the only OECD countries, and really one of the only countries in the world. Of course, India and Brazil have massive school food programs, as do Finland and the United States, and so many. It is interesting in terms of social policy, because one of the reasons Canada didn't have a school food program is that when they talked about it in the cabinet in the 1940s and 50s, they actually came up with a good, almost social democratic answer, which is they wanted to live in a Canada. They wanted to create an economy and a world in Canada where people could afford to buy the food of their choice for their children. And they did not want to follow the welfare state model of a subsidized school food program like the US or the UK. So that's an interesting thing in terms of where we are now, because of course, flash forward between 1950 and today, women, first of all, double rate of participation rate in the workforce. Lunch hour is a half hour instead of an hour and a half, where kids might have walked home. And of course, the whole fast food crisis, which puts all of our children of all income levels at jeopardy of eating unhealthy food. So finally, a movement has convinced the federal government that they should do something. And finally, in Minister of Agriculture and Agri-Food, Marie-Claude Bibeau, and Minister of Families, Children and Social Development, Karina Gould, there is that those ministries will work together and launch a school food program for Canada. At the same time, we have a really interesting moment in the world, because COVID has demonstrated many things, as we all know, about inequities, about where there are huge problems and needs. I mean, Suman again talked about one in terms of increased food bank use. But COVID has demonstrated that school food is an essential service. And that's not something that we even used those words before COVID. What that's meant globally is that a new network is there. It's called the School Meal Coalition. Its name's a little bit awkward because it's almost the same name as the Coalition for Healthy School Food, but this is created by the World Food Organization, started by Finland, and then France, and actually United States, Russia, and many countries, 60 countries have signed a declaration that says by the year 2023, bring all school food programs back to pre-COVID levels. By the year 2030, make sure that all the countries in the global south that are now aid dependent, you know, having a school food program financed by Bill Gates or the UN, will be domestically supported. And by the year 2030, every child in the world have at least one quality healthy meal at school. And the language of the 2030, which is of course the Sustainable Development Goals year, is really to look at the health and well-being of all children. And it's really interesting to see where the movement has gone. The people who are running this great new movement globally talk about public education being one of the acquisitions in the world, and that every country now has a public education system, and that by 2030 we need a public school food system. So this is very visionary. How we will get there in Canada is going to take some complicated negotiations. The first allocation of money isn't enough. It's only 200 million. You don't have a quality school food program without billions allocated. So we have a lot of work to do, a lot of work to convince the provinces and territories to take the money, particularly Quebec and also Ontario. Ontario has not yet, of course, as you know, signed the Child Care Accord. So lots of activism to go before we get there. But I wanted to bring it back to Scarborough, and I wanted to bring it back to community, and I wanted to think about how we as a community in Toronto and Scarborough can look to bridge the gap again between community programs, social policy, and all the things in between that we do together. I always have been so impressed that Scarborough has continually thrown up these really great networks like Suman's. In fact, the first network of its kind in the metropolitan Toronto area was the Scarborough Hunger Coalition in the late 90s. People might remember the names Peter and Susan Butler. And actually the first full-time school food coordinator in the city of Toronto was in Scarborough. A woman named Debbie Lay worked in Scarborough for 3 years, helping to facilitate community-based school food programs. Scarborough also was the place where one of the most innovative studies ever done, funded by a little Trillium grant, operated by the Scarborough Hunger Coalition. And it was the first time in Canada where we asked people at a variety of locations whether they had missed a meal. Usually the paradigm in Canada is to talk to people who go to a food bank. And so our hunger count vastly underestimates the level of food insecurity, because if you're only talking to people going to the food bank, and what's, as Suman has explained in terms of stigma and judgment and how immigrants and a variety of people feel about food banks, you're underestimating the numbers. So the Scarborough Hunger Coalition put together a survey, and they sent out interviewers to food banks, but also to the schools, the community centers, the welfare office, a variety, the libraries, a variety of locations. And that study was the first time that we saw that, first of all, unfortunately, a lot of people said they'd gone without food that week. Something like 80% of the people they interviewed said they had gone without food, but only half of those who said they'd gone without food ever used a food bank. So whenever you hear the food bank numbers, you really want to double them in your mind. And you want to think about all of those complexities. And of course, Suman and his food bank is now modernizing, thinking of stigma, online, choice, all these things. But then that leads us to other community-based solutions, again, that we can think of, that we've been pioneers with in Scarborough. The Bendale School Garden, which Food Share facilitated. I mean, it's not there anymore because the Marion David Thompson building has, school has taken it down, but that was the first acre garden at a school in Scarborough. The community markets that Food Share ran in Scarborough were some of the most vivacious and experimental outlets where people of all incomes, again, could put down for wholesale prices and get produce. The work that the East Scarborough Boys and Girls Club, and I know they're a partner of many of the networks here today, are doing of culturally appropriate food being distributed in boxes, and also after for programs. And partnerships between us all to develop capacity and learn. And it's great to recognize 3 students. Chantel is on the line, Nina and Nicole. These are 3 students who've worked with Sarah and I and Jaita in this great community partnership that we have with Scarborough U of T. So bring it back to this idea that we, during COVID, see so much of what needs to change, and that really we have to rely on ourselves and our communities to mobilize ourselves with community-based solutions at schools and community agencies and community initiatives to experiment with community programs that can be effective while we advocate for social policy. Thanks.
Thank you, Debbie. And yes, I want to also welcome our wonderful Feeding City Coalition Dalalana Masters interns, as well as I see folks from the SCSU, the UTSC Students Union, who've been very vocal and worked with Suman and others on food advocacy, as well as other people from the community and beyond. And now I call upon our wonderful collaborator, as I said, a former graduate fellow of Culinaria Research Center, now an assistant professor at X University, an award-winning author of books on local food systems, and now also the director of the new Food Health Ecosystems Lab, Sarah Elton. Thank you, Sarah.
Thank you, Joe, and hello, everybody. Boy, I really enjoyed listening to Suman and Debbie, and I wanted to jump in and ask you to bring together 2 of your ideas. Suman, you said food care. Love that idea. It speaks to so much. As of food as the starting point for our health. Debbie flagged the fast food crisis that anyone who works in food or just eats and has to navigate a supermarket or deciding what to eat for lunch will be facing the fast food regime that surrounds us all. And so we know that not all food is equal. So in thinking about food insecurity, how might we think about food care and prioritize healthy food? What in your world, Suman, and in your world, Debbie, what might we do to put health first, or what is being done? Because I know this is something that is you're both very well aware of.
Yeah, I think it's really interesting you say this, Sarah. This past Sunday, I was at the grocery store shopping for my home, and a pint of raspberry, not organic, regular conventional, was $9.99. And yesterday, KFC was giving out Toonie Tuesdays. So that disparity is certainly a huge challenge that we see in the communities, especially when people are strapped for money. What do you think they're going to buy? Are they going to spend the $10 for the raspberry, or Toonie Tuesday, feed up 2 fried chicken and you're good to go? So I think, and that I think is a huge challenge. And we haven't seen much from a policy standpoint actually tackling these kind of crises. Like it was been, and I remember those days when I was with Debbie at Food Share. And if you I walked up to a grocery store, a piece of pear costed me almost 75 cents, but 25 cents I could buy a KD craft dinner. And this is not a new challenge. This has been existing for years and years and years, and that is where we are having a problem even now. And it's going to continue until we actually tackle various policies that make these basic fundamental changes in how we eat and how we access food.
Yeah. I think actually that we need to think about subsidizing vegetables and fruits as a standard part of how we get to the solutions. And it's been, something I've tried to develop and get very little support for. When I was thinking about today's panel, I was thinking we're going to, there'll be a small enough group here that we can actually kind of puzzle it out a bit and really focus on it. And it's always great, of course, to look at the Indian model of Kerala state. So, Jeta will correct me, but my understanding is that in Kerala state, when the communist government was in power, and this Kerala state, of course, is the state in southern India, which is one of the most progressive states around women's rights, and people self-describe as having one of the highest quality of life, even if the income is not as high as other correlations. But in that state, the people in that area liked a particular rice, and that was grown in a neighboring state. And so my understanding is that the state government bought up from the neighboring state that rice, made it available along with several other beans in all the outlets. And so that 98% of the people in Kerala state, and I've met people who've told me they remember as a child shopping. So everybody would go and they would get this food at a lower rate. And so what I've taken that as an example to say is, what if in Ontario there were 5 things or 10 things each month, changed seasonally, that were available everywhere at wholesale prices, even where people bought their cigarettes or chocolate bar, right? So it could be, apples at 25 cents a kilo, apples, cheese, soy nuts, we could think broccoli, carrots, potatoes, and they could change each month, right? So, and it would be seen and of course, farmers would get the full price, and it would be seen as a health promotion, the local promotion. This also is connected to, of course, some of the great modeling of what's happened in Brazil with the Sacalo markets, where you get, and that's what, Food Share modeled our good food markets after it. So a variety of ways that we would actually differentiate at the price point in the way that we do. Think about garbage in Toronto, how great it is. I put out my little tiny garbage can today and I get a rebate from the city if I don't have a big garbage can. We know that in a transition, using market maneuvers or mechanisms to help encourage proper behavior could happen. So that's one way that it could work. The other way is that we fund community markets everywhere. And that we try to, and then really a school food program is in fact a part of subsidized food, because even if parents pay a minimal amount, it's obviously there's going to be infrastructure and a variety of other components that are subsidized by government. And, what I always say is in Toronto, we have a great transit system. When we put our $3, or we had before COVID, and when we put our $3 in the fare box, that's not paying for the whole ride, right? We know federal and provincial and municipal government will subsidize. So somewhere in here, there has to be a breakthrough, I think, Sarah, to reward the foods that we think people need to be eating and to discourage. And in fact, we have the opposite price point, as Suman has explained.
Sarah, if I might jump in. Oh, sorry, Suman, go ahead.
I was just about to point out to Debbie. Debbie, I think it's an important conversation to have around when you started the subway markets. in the 6 or 7 subways, and how important that was to somebody like me, who at that point in my life, I was a very heavy meat eater. And just because it was there and it was reasonably priced, when I'm leaving the subway and I could buy food, it certainly upped my game on produce. And Debbie, I know it was your brainchild and it was fantastic.
Barbara Manuel.
Yes, and one of the, I think this was also from your time at Food Share, Debbie, which was that when my daughter, and I'm a new Canadian, and one of the great things for me to see when my daughter started kindergarten was the fruits and vegetables every week. And I think that was so important for so many families and continues to be so. And for when I encountered the work of the coalition, learned that there isn't a national school food policy. And yes, coming from a country like India, where one knew that the midday meal provided probably the only food millions of children got. And now the recent right-wing fundamentalist policy of denying the egg, the one source of protein that many of those children were getting, has been just devastating in terms of nutrition and health. But I wanted to also say quickly, and this is, probably a broader discussion, but one of the things Sarah, I, and our wonderful Feeding City research team have been examining is the literature. And one of the things we saw was that we hear a lot about the agricultural subsidies in the US. But one of the things that those agricultural subsidies in many countries do, and surprisingly not in Canada, is that they help through the pandemic, not only local farmers to stay afloat, but also to quickly provide food access. So whether it be dairy, cheese, fruits, vegetables, and so on. So you provide local farmers through that procurement lifeline, and you also make sure that it can come. And to my shock, I realized that in Ontario, the only kind of thing one has is that laughable tax credit. So basically farmers who go to the trouble of harvesting, transporting, and delivering what, at that point is probably unusable produce, get 25% tax credit. That is where, as all of you have pointed out, policy change is absolutely needed. I wondered if we can quickly call upon Matilda, who's been doing a wonderful health studies independent study with us, where she has talked to Debbie from the coalition, but also to Suman. She's been talking to Marina Curello of Markets Toronto, as well as who's worked with Jennifer Ford of Red Onion Scarborough Farmers Markets, and with Suman and Feed Scarborough on what they've called the Scarborough Toronto Market Bucks program. And this is a program that is still an idea because, in fact, the support necessary to launch it hasn't happened. But Matilda, if you can very quickly tell us what your study has shown.
Yeah, thank you so much for the opportunity to jump in here. I think this is, I think it's the work of the Market Bucks initiative and putting together this kind of program, I think is very relevant to this exact point in the conversation. So what we've been looking at, and what I've been looking at is vouchers programs for farmers markets. And that is basically a way to ensure and to enable a more diverse set of populations to be able to access farmers markets and access the benefits that come with farmers markets, and whether that be fruits and vegetables at more affordable prices or a variety of other products that are only available at farmers markets. Because as studies have shown, farmers markets are sites of food diversity, not just fruits and vegetables, but a variety of foods that might not be available even in supermarket chains, which have just dominated our food landscape. Here in Canada, in Toronto, in a lot of these regions as well. And it has taken a lot of work to put this forward. There have been models of voucher programs in farmers markets that have been modeled in Toronto and the GTA. The Junction has a very successful model. And even on a broader scale, the Junction farmers market has a very successful model. But then on a broader scale in British Columbia, they have actually subsidized a vouchers program where they give participating families $21 a week, I believe, to be able to use coupons at different participating farmers markets. And this allows a wider variety of people to be able to access markets, and for farmers markets as well to benefit from having a diversity of new clientele and of customers and of people that are ultimately showing more ownership over the food that they have access to, but also the food that they're providing.
Thank you, Matilda. And I should say that from the Junction Farmers Market, we have some wonderful students at the University of Toronto who've also been working on the board and as market managers. And from them, we've learned that every year the Junction Farmers Market, pulling together donations and some small grants and so on, has managed to provide a few $1,000s worth of these vouchers, and which have been really critical. However, that's one of the farmers markets, one of the neighborhoods in this, even in the Greater Toronto area. Recently, my wonderful health and society colleague, Professor Obidima, agreed to spearhead a grant proposal where we advocated for a study which would show how such a vouchers program, as linked to the farmers markets that feed Scarborough on one hand, and the Scarborough farmers markets led by Jennifer Ford, implemented. Unfortunately, that was not funded. But, again, that's a Band-Aid solution. What we need is a policy change that recognizes that food and nutritional security is a human right, and that state policies should, on the one hand, support our local food systems, our producers, and on the other hand, bring that. And, for me, it's always amazing. Canada is a wealthy country. And this is something very, very basic and intrinsic, where if we talk today about the Eastern GTA and health inequities, food is absolutely basic to those. And as Suman has eloquently pointed out, so are those other issues. I wanted to ask if I see Tinashi Kaningono is actually in there. Is Tinashi still there? I think I saw him a minute ago. He may have left to go to the Scarborough Food Network meeting, in which case he and others will be here shortly. But since we have other students here, I wondered
also,
if...
I forgot to also
Yes.
mention that Veronica has been working with the coalition, and Veronica might share a little bit of the great interview she did with Nadira on what East Scarborough Boys and Girls Club is doing.
Yes, Debbie. So Veronica has gone. Oh, Tinashi is still here. Good. Veronica is going to be shepherding the Scarborough Food Network members in. And Nadira actually told us that she's going to try to make the meeting, but she has a problem with her Zoom connection. And she's authorized Veronica to share, what the Scarborough Boys and Girls Club has been doing, especially with culturally specific foods. But Tinashi, if I can ask you to kind of speak even before the network comes in, it would be really wonderful. Thank you.
Hi, can you hear me?
Yes. So Tinashi, would you like to just quickly introduce yourself for those people here who do not know you?
Hi, good afternoon. My name is Tinashe Kanengoni. I am the program manager for community food initiatives at CICS in Scarborough. Sorry, my voice, I haven't been feeling well. I just come out of a cold. Yeah, at CICS, I guess, where do I start? A lot of things have been happening since COVID, but I would say the biggest shift came in because we were really under more on building social connections through food and culture because of the newcomer and immigrant context. So therefore the different spaces and the different foods were kind of the merging spaces. We were working with Link early years and just kind of integrating a lot of the food programming within the organization as an internal process before COVID happened. And then when COVID happened, we're not really pushing on the food security side. It wasn't something that had yet been acknowledged, I think, from, I'd say, a Chinese perspective. The idea of picking up food really wasn't in place until we inherited food bank from the libraries. We had the infrastructure, I had the experience. They really needed someone to take it on, and then pitched it up to the organization that I think it was necessary to take it up. And then when they realized that a lot of the, let's say 75% of my clients were Chinese, that's when the organization kind of realized the food security kind of framework opened up from us being in the gym and moving into a warehouse space and then helping us with infrastructure. In that process, because we're dealing with a lot of cultural diversity, I had experiences working at Lawrence Heights. So one of the first things was seeing a lot of people coming with hijabs. Then how do we implement halal, start outsourcing halal-based food, and then the quality, and then realizing we're seniors and looking at our hampers and realizing I was just handing out diabetes here. And then, so really over the short period, we have started shifting towards being culturally responsive. So shifting from pasta to rice noodles, the vegetable types, really involving the community in decision-making, in the process of developing a food bank advisory group that really meets quarterly, helping us shift needs and having the voice. So that's another piece. And then on the other side, we've also expanded in partnership with the Scarborough Food Network. In response, another challenge we then had around the pandemic was culturally responsive seedlings access. So the okras and everything are generally coming from a global food system. So we're talking about global supply of seedlings that relates to a lot of like the newcomer context of growing food. And we had been working from the Scarborough Food Network that different organizations have been growing food for different food banks to increase supply of culturally appropriate food. So the next level was, how can we expand this? And so where we are, we're in the process of constructing a greenhouse to produce about 15,000 seedlings that we're gonna distribute, really focusing on, our focus may not be on food security, but on social cultural networks. So we have diverse groups working together in a greenhouse. So looking at resilience as a space of using food to build bonds that may be supportive rather than looking at it. And then regional capacity to produce what you need at a smaller scale as a future resilient strategy by building independence and self-sufficiency at individual level. It might not be a large scale, but the knowledge will be valuable in the future. So that's the kind of direction. And then within the network process, we are also having seed gardens, because the other thing is, as diversity of newcomers change, diversity of seeds change. And I think having our own seed bank would be more appropriate to support the diversity of seedlings we produce. The space is really worked through a collaborative space sharing. And so we're also looking at organizational capacity building of all the organizations to do some anti-racism work, trauma-informed and culturally responsive training, so that we are all aligned within the concepts of what we're doing. So that's a quick rundown between what the individual organization is doing, and then the focus on social cultural synergies as a strategy for like food sovereignty, independence, self-sufficiency, or sense of like strength and power and acknowledgement starting from your own food sense. I think I'll stop there.
Thank you so much, Tinashi. Before we go back to the Q&A, the virtual chat, I just want to highlight that Tinashi Kaningoni and CICS Canada are part of the Scarborough Food Network, a a group of community organizations, city representatives, residents, and stakeholders committed to advocating for increased local food security, which ties in food access, food justice, literacy, as well as intersections of food with health, culture, environmental sustainability, and economic development, and helping to advance a collective dialogue around building a resilient and sustainable food system, as well as celebrating the richness of community-based food initiatives and food cultures in Scarborough. So we will be joined in a few minutes by community advocates from the Scarborough Food Network, including, I'm hoping, the representatives of the East Scarborough Girls and Boys Club, which have played a really, really important role in pursuing those same culturally specific, culturally ethnocultural foodways that Tinashi referenced, that his organization has also done. I want to ask Sarah now, if Sarah, you want to give us some more insights into where you think the big picture could be?
Well, I really like to hear Tinashi's description of gardening, and and then connect it back to both what Debbie and Suman were saying, in that in terms of gardening can be in the city, can be actually an invisible policy solution. It can be dismissed as recreation or a hobby, but when in fact it's a very big promoting urban agriculture, some people would call it. I like to use gardening because everyone knows what gardening is. Vegetable gardening in the city can be very transformative and radical and health supporting in so many ways. Like, let's just flag like what Debbie was talking about, Bendale. I know the school there, that particular garden isn't there anymore, but I recall, and please correct me if I'm wrong, Debbie, this is from research from, gosh, probably 10 years ago, but food grown in that garden was cooked by students in the cafeteria and served to other students for healthy lunchtime foods. Foods, we've heard today of foods being grown, vegetables being grown in gardens for food banks, especially culturally significant foods that people want to eat. And I know from my own research that many people in the city are growing these culturally important vegetables in communities where they could go to the grocery store and buy foods that are flown in from faraway places that are important. However, many people have told me, no, I want to eat organic okra. I want to eat organic fenugreek. So I'm going to grow longwood, and I'm going to grow it in the way that I want to eat it, which gives them access to food sovereignty. And then, of course, there's the health supporting nature of gardening, just being together, gardening as a group, or being together, just physically gardening and having that exercise or that connection, that time with plants that so many people report to bring them peace and happiness. And I will even say interspecies friendships, which are things of urban life that we dismiss or we don't think of as being serious or policy solutions, but when in fact the simple act of promoting gardening in the city can be, and providing space for it and funding and infrastructure, as Tinashi was saying, in terms of greenhouses, seed banks, can be so fundamentally important to well-being and health equity in our city.
Thank you, Sarah. And I just want to point out here, unfortunately, the Collider event as part of the symposium that's on mental health supports is happening at the same time. Hopefully, we'll all be able to listen to the recording later. But what you said resonates so strongly that when we think about health, it's not just the physical health, it's the mental health, it's the emotional health. It is the bonds, the emotional well-being of people living in a community. And that is what we are hearing so strongly from all the bodies of evidence that have come from people who are growing even, perhaps a few, scallions on a windowsill or in their kitchens, or who are fortunate enough to be able to band up with others. Yes, I absolutely agree that, we need to talk about policy change, but also talk about these kinds of small and big changes. And, and so when the Scarborough Food Network comes in, what we'll have is folks who are doing all these different types of work, as indeed Suman is doing. Suman, thank you.
Yeah, no, I think I wanted to point one thing. In Scarborough, as compared to other parts of the city, people have a lot more land attached to the houses. So certainly a progressive policy around urban agriculture, around gardening, will certainly increase food security within our Scarborough boundaries, for sure. That's one thing I wanted to point out. And the other quick thing, yeah, sorry, go ahead, Debbie.
I just want to say on that before we leave that, and because I have to leave in a few minutes and I won't be there for the rest of it, is to remind us again that Scarborough has more farmland, grade A farmland, than anywhere else of our cities. And I think everybody knows that you can see most of the grade A farmland in Canada from the CN Tower. But because of the development of Scarborough, and the way housing was built on farms. So there was a study done, and I don't know, Sarah, if you've ever seen that. There was a study done of the zoning of schools, and many schools in Scarborough were farms before they were schools. That's part of the whole punchline around Bendale and the Mary and David Thompson. Mary and David Thompson, that was the Mary and David Thompson farm. So you can literally stick your shovel in the ground in Scarborough and grow food easier than, not only anywhere else in Canada, but anywhere else in Toronto. And so again, I think that idea of a multifactorial concept of the schoolyards and opening them to the parents as well as the kids, but also all the Toronto community housing buildings. I mean, some of the best big community gardens that we've ever seen in Scarborough, in Toronto, have been in Toronto community housing buildings in Scarborough. So I think there's a lot of momentum and the integration. It was great hearing Tinashe and thinking about where the agencies who are the linchpins of this in Scarborough, right? Because it's not going to be government who's going to garden. It's going to be agencies who are going to be able to open up and garden with others. So anyway, very exciting. I'm sorry I have to go to another meeting, but it's been a pleasure as always to join you in Scarborough.
Thank you so much, Debbie. And Suman, do you want to, especially with Tinashe here, because one of the things I've been thinking is, so Tinashe's organization, CICS, is actually, and I think you're part of that as well, the SAFE collaboration. And, perhaps Tinashe, you'll tell us a little bit more about it. But at the Scarborough Food Network, every month we are able to hear wonderful folks from the Morven Farm, for instance. We are able to hear about the hoop houses and the greenhouses and so on. And in fact, we've just had the pleasure from Feeding City of connecting folks from Centennial and UTSC who are working on those issues, and at the campus farms to the community. So Suman, is that something that Feed Scarborough feels that your community garden, which is also gathering place, I've myself sat and eaten lunch there, but can also perhaps connect, gardens, not just for, the physical health, but also for the mental and emotional health?
So, Professor Sharma, before we move too far away from something that Sarah and you had mentioned earlier, I wanted to bring up the other hat that I wear is I'm the executive director of Meal Exchange, which is an organization that works coast to coast to coast with post-secondary students on food security. And one thing that we have seen in the last 6 to 8 months specifically, the tremendous relationship of mental health with food security. This is something that we always, when we are food security advocates, we're talking about hunger, poverty, we always don't take our mind there. And it's really, there is a strong collaboration. I could talk about that for another hour, but we're going to spare you from that. So we are working with Simon Fraser University in a research project around that to actually quantify the relationship within mental health and food security. But to your point, yes, there is certainly mental health is a huge need, and gardening certainly helps in supporting mental health, especially with, and I'm going to go back to my earlier comment about immigrant population in Scarborough. A lot of them in their first generation, they are coming with less funds. They're living in apartments. They're coming from a background, a lot of them, not everybody, but a lot of them who had land, who was growing their own fruits and vegetables back home. And now they end up in a country, in an apartment, cooped into a 600 square feet with 5 people living. Half of the year it's covered with snow and gets dark at 4:30 p.m. So certainly there is a mental health challenge. And our garden, we have 2 gardens currently. We are just starting our 3rd garden this year. And it's certainly a place where community members come together. Not only they are growing food and supporting their food security as well as the community's food security, but actually getting their hands dirty in the ground, growing and connecting with others through produce and through growing food and celebrating food.
Thank you. Tinashi?
I guess I wanted to add a bit, what is the connection? I guess from a strategic place, our work, I would say, really, it's rooted in the social determinants of health. And within those, I would say when I'm talking or writing strategically, I've chosen 3 pillars that within our strategic plan are weaved through the different activities, and they're coming out of the first, the food security as a component of social determinants of health. And then there's the social connections, which is really around persons building connections, relating to others. And then the last piece is the social inclusion that sometimes is the racism or anti-racism, or sometimes bracketed as culture. So within everything we're doing, what we're doing then, those are the, when I say the final pillars I'm weaving within, I can't go into housing, I might incorporate it, but the things that I use the food security, I'm also integrating issues around the space where there's recreation clubs. But in terms of social equity, I'm starting advisory groups, I'm bringing leadership spaces, and bringing trauma-informed training within organizations, in the collaborations, aligning and understanding of what is anti-racism, or working, not assuming just because we're racialized people, therefore we know. So creating a common space then allows then the policy connection of what we're doing with the broader institutions that align it with health and wellness. So that's the way I would simply describe it as. In terms of a community action, it's really growing out of the social determinants, but the actions we're bringing in are different. It could be a training, which is really focused on organizations, and then on leaders that are trained to understand how to voice these policy frameworks so that they're elevated from an authentic space and informed space, creating spaces that can be also vehicled. Not participating in the network doesn't mean it is effective, but a place when they're working with their peers away and bringing a concern to us creates a mechanism that is authentic. So how do you animate those spaces? And therefore the results then come back again. You're filling in the social inclusion, participation in decision-making. So it's really how we implement within broad strategic plans, and then in the implementation on the ground, it's reflected how those pieces come in to play.
Thank you, Tanashi. It's 2:00, so soon our other members of the Scarborough Food Network, we already had Suman and Tinashi from the Scarborough Food Network here, but the other community participants are coming. They've been gracious enough collectively to agree to lend us about 40 minutes of their own meeting time, which is today from 2 to 4. So they're going to be joining their own Zoom meeting and then coming to this one, facilitated by our wonderful UTSC health and food researcher, Veronica Waba. And we do know that Nadira from the Scarborough Girls and Boys Club will either in person or ask Veronica to share the anti-racist principles and also the culturally specific pandemic food assistance that her organization, which is a valued member of the Scarborough Food Network, for instance, has been able to provide. Before we go there, I wanted to ask if anyone from the audience wants to speak. Okay, so Sarah?
Well, I think there's only one last thing that I'd like to say, and it's thanks actually to Tanashi raising the social determinants of health, which are such an important guiding principle. Something that I love to talk about, and I certainly write about them in my academic work, and I really want this idea to break free from the academic confines and be embraced like the social determinants of health have, but they're called the ecological determinants of health. And food is an ecological determinant of health. So just like the social determinants of health are things in our society that determine our health. The ecological determinants of health are all the parts of our biosphere that determine how healthy we are, that we need to be healthy. So food is a product of ecosystems, fundamentally a collaboration between humans and non-humans. As we say in my little tiny corner of academic work, and we are talking about all this during the climate crisis. And so I think that if we think of food and food insecurity in the context of the ecological determinants of health, we can also help to think about how the solutions we propose also might address climate issues in our city. And so back to that gardening question, as an invisible, often overlooked, not invisible, often overlooked policy solution. There could be other policy solutions that at once address the social determinants of health and food insecurity, as well as the ecological determinants of health. And in the end, help us to provide a healthier and more just and equitable food system for everybody, because of course the food we eat connects us fundamentally to the biosphere in every way. We take it in our bodies, it fuels us. We cannot be healthy without it, and we can't be healthy without healthy ecosystems, including food systems. So I hope this idea of the ecological determinants of health might be able to guide us as we talk about policy and community solutions to the problems that we face in our city.
Yes, we also have a climate action. So the seed saving, climate education, so capacity building after the social infrastructure. Now it's more like the educational piece. We're still at the social infrastructure and the form. I think once we align that, then our learning spaces are really focused on. That's why the seed saving also became part of it, because it's kind of a climate action response. So that's another piece I really didn't, because it's in phases. Physical infrastructure, social infrastructure, and then community learning and social networking stuff after, the cultural experience.
And I can imagine, Tanashi, that saving the seeds is such an important act of biodiversity preservation and things that people might not think that they have, like I can control the devastation of biodiversity in this world, but actually in Scarborough, in your seed saving project, everybody can partake.
Yep, and our gardens won't be monoculture because everyone's coming from different cultures.
Oh, interesting. Really, the double meaning of monoculture in that context, the monoculture of the industrial field versus, I love it.
Yeah. So it's layers. But my background is also environmental studies too.
Oh, super.
We've had a little update thanks to Kim, who's managing the IT side of this. That Scarborough Food Network will be here in about 5 minutes. Veronica has left this meeting, gone to facilitate that one, because we at Culinary and Feeding City are honored to be the Zoom facilitators, as it were. So I want to actually point out here, I think, connected to this discussion, the important study, the research study that Access Alliance did some years ago, which is actually there on their website. First, as an academic, it was very humbling and important for me to read there. They pointed out the short-sightedness of so many academic studies that are geared to very short-term objectives, rather than the long-term needs of communities, which, dare I say it, on the eve of an election has much in common with the urban policies in a city or a province, where often it's geared to the short-term horizon of electoral gain. But coming back to Access Alliance, they had this wonderful green access, the Eco Leader program, which not only had the peer-to-peer training of immigrants from the community and then spreading the word about ecological ways of growing and living, but also they did a study which really importantly showed that newcomers didn't need to be educated in ecological ways of living. They didn't need to be educated about sustainable foods and so on. What they lacked was access. And in fact, that is where the wonderful community garden, which was the first one I had visited in Toronto many years ago, then been able to take my students on the rooftop in Toronto's Little Bangladesh. And now, of course, Suman's one, the one that Tinashe's CICS premises has, the ones that the Scarborough Food Network's organizations propagate, not just bring community together, but serve as testimony to the knowledge, the embodied knowledge, the ecological food and health knowledge that our communities bring with them.
I think that's so important, Joe, that what you flag. And I think that often just the depth of ecological knowledge that everyday people hold is also something that we don't recognize. Like, and by that I just mean gardeners. Like, gardeners have so much ecological knowledge. They're dealing with climate change every day, and so that's a really good point. And secondly, I also want to. I'm curious to know, and perhaps my question is for Suman and Tinashe, how we all know, and I know you both are very aware and active in thinking about climate and the environment. But how often are you asked to perhaps put that second? Like, that's a nice thing to think about, but this other priority comes first. Is that something that you face? And if so, how might we blend those two priorities together?
Sarah, I think from our perspective, it is a very difficult sell for people to really see food security and gardening or growing food as a solution, one of the solutions to food security in the same line. Generally, it is seen as very two different things, one not to do with the other. And which gets really challenging, not only from how the clients or the community sees it, even from the direction where the funder sees it. The very less funding is available for garden project, excuse me, as a solution to food security. Like, we have applied over the last year and a half with our garden project to various funders, and invariably we got denied all of them. But when we have applied for funding for a food bank or buying food for a food bank, money is not a problem. So I think that is a huge change that needs to happen in the thought process, and really with probably with more research. And we are, as we mentioned, in Scarborough, we're in a very good place to actually tackle that because of our land availability, to have some proper research done so we can build more advocacy around that.
I would say, first, from a resourcing, I've just come out of a Pollinate TO grant. So really, it depends on the flow of resources, and then the ability of the designer of the programs to sell it to the organization, because I think I'm also coming with it because I'm within the context, so it's already embedded from my knowledge. So I think that's another thing. It's not that the community uptake because I have people coming to my programs for recreation purposes, and they get to learn that stuff. So creating the space, many people come for an experience to take out the kids to do something, is how I was creating the spaces, not one where I am drumming a beat to say we're in trouble, we're in trouble. It's people looking for an experience, and then I'm embedding this philosophy to meet their need of having a free space. So that's the first piece. And then let's say with the greenhouse, strategically, from an institutional point, there's no place for me to go climate change. But somehow the resilience around food and the anti-racist sentiment at the time gave room for me to sell it as a pitch that married the greenhouse and food security. But in the
Kim, did we lose Tanashi's voice?
I think, sorry, what I was saying with the greenhouse is instead of making it, I haven't got to the educational part, but I'm quantifying the value, because I also know about GHGs of the 15,000 seedlings. So what we're doing then, that's what I'm saying, it's coming from a strategic point that what's the minimum viable thing I can do to show this value so that I can get resourcing for it, because institutionally, they can't even see that connection. So before I even go blame the community's uptake, as a middleman who understands both worlds, institutions are not acknowledging it. And therefore, later, once that's running, then I'm gonna say, this is how much GHGs I've saved through this act. So from the action rather than from the education.
That's absolutely fascinating. Thank you. Really interesting and great, and such good work. Like the GHGs of 15,000 seedlings. I'm like,
No, it's
blown
amazing.
over.
So thank you, Sarah, Tinashi, Suman. We are starting the transition now to the Scarborough Food Network members starting to come in. Wonderful. Kim, I think you don't need to stop the recording. We'll just ask them at that point if we need to pause. And Matilda, perhaps you can join. So this is the brand new web page that is still under construction. Again, facilitated by our wonderful, wonderful student researchers and our postdoc, Noah. And so this is the web page, because this is one of the ways in which, we felt that our collaboration from the university using various research grant funds could be meaningful, but also the skills and knowledge of our students, that the SFN community organizations have sent us their mission statements. And so we have our students, you'll be meeting one of them, Veronica, who will be coming in shortly, and the SFN members. So you can go at the, to the new web page, and which is still in progress, but there's also a wonderful Facebook page. Matilda, if you can post that link in the chat as well, and you'll see that there are lively discussions that happen around all the different activities and events that the different partners hold. I just saw some new materials from Feed Scarborough when I looked at it yesterday. And of course, what we hope is that more people will follow these web pages, like these pages, and bring their own insights and talents to the Scarborough Food Network. Thank you. Are we, Matilda, I think you can stop sharing. I see that a lot of people are here now. Ilham, are you here? I'm sorry. Oh, yes, I see
Yes,
Ilham.
I am. Yes, I am.
Hello, everyone. May I introduce Ilham Saidna, who works for Daily Bread, which needs no introduction, but is also the co-chair of the Scarborough Food Network. And so Ilham, thank you so much. Welcome everyone from the Scarborough Food Network. We are indeed privileged and honored and thankful that you've interrupted your monthly meeting to come. And we've already had Tinashi and Suman from the network share much of the work they're doing. And so now we invite SFN members, starting with Ilham, to talk about the issue at this Collider event, which is food access and food equity, healthy food policy and community collaborations towards nutritional security. Thank you. I think you're muted, Ilham.
Yeah, I have that habit. Hi, everybody. And my name is Ilham Saidna. I work for Daily Bread Food Bank, but I co-chair the Scarborough Food Network. I always call my role at the Scarborough Food Network as facilitator. So we are this horizontal structure that comes and meet monthly to like collaborate and come up with initiatives and ideas. How can we have more food access in Scarborough? So what do you want me to focus on for this, and how many minutes you want me to speak for?
Ilham, I think if you can very quickly tell us about some of the important initiatives that Daily Bread has been doing to support the work, especially of the different organizations that are here at this table. Thank you.
So in terms of food bank, you mean?
Food bank, but also really about, I think, what is really important initiative, and you brought to the Scarborough Food Network, the report, the people who had presented the report, the hunger report from Daily Bread, which is such an important intervention.
Definitely, yeah. So Daily Bread runs a research project every year to assess why people need food banks, and how can we use policy advocacy to change this reality. So we are in a good position to do that, because we run about 200 programs citywide. And when people come to the food bank, we have this small survey, and people speak about their situation. And so we find this is a good allyship project, that when people consent to give their information, basically, yes, they are anonymous, but they don't give like personal information, but they speak about their income, about what changed, their housing situation, and they speak about the issues that cause people to go hungry in the city. So normally, after we do this process, collecting our database information, we design a survey that we will be going face-to-face. But during COVID, we started doing this by phone and by the internet, which is a huge barrier for our community, because a lot of folks have no access to phones or to the internet. So we try as much as possible with allyship with our members to do a face-to-face survey with those ones that are willing to share their experience. And in addition, we also do an in-depth interview with select groups where we give incentives for their time, and because we want to focus on certain areas. So most of the times, folks who are coming to us are seniors, immigrants, people who came to this city from other countries, and they were brought with the promise that they're going to find a job and they're going to manage to earn an income that will support their family. So, and in addition to that, mental health is a huge problem in our city. Housing is the biggest eater of people's income. So that's why we did a lot of advocacy on housing issues. Mainly our call was to create a portable housing benefit, which is not like giving people some subsidy or money, just like the child tax benefit. So the child tax benefit was also the work of this process. Long time ago, I don't remember when through this process, we found out people with children needed that kind of support. So we are calling for the province, the government of Ontario and the federal government to consider creating a portable housing benefit where people, according to their income, they can get like a certain amount of money for all people, working or not working, to get that certain amount of money, regardless of what neighborhood they want to live in, or what city they want to live in. And we are also working on the disability, increasing disability funds for people. We find that in some of our data, that if the disability fund was increased, it will reduce the number of food bank visits drastically. So that's the main like area we want to support our members. In addition to, of course, the procurement of food, we purchase more than 60% of the food that is being distributed in our programs. We focus on halal meat and produce, especially in Scarborough. And by the way, Scarborough has more than 60% of daily bread caseload. 2 programs in Scarborough, each one of them has more than 10,000 visits a month. 10,000 people visiting this food bank, two food banks in Scarborough. One of them is Dorset Park Hub, which is by Ellesmere and Kennedy. And surprisingly, across from it, right away, Grace Place Church. We opened Grace Place Church to relieve pressure on Dorset Park Hub, but now Grace Place Church is started seeing the same amount of people, the same number. These are not the same people, but the number is going up. And I was in the food banks last week, going every day, visiting and just observing influx. Now we are seeing per day, maybe each food bank is registering 10 new households. 10 new households who had never used a food bank before now are needing the food bank, because we all see that food prices are skyrocketing. We also know what's happening with housing in this city. And if you if you get evicted right now, there's no way you can go anywhere, because just renting now is a huge problem. So that's why we are seeing these numbers. Now we're gearing up for our Who's Hungry for 2022. And I was in a meeting just now. We were talking about the instruments and all that, research instruments. And so it's gonna be another story that is overwhelming, and hopefully we can all engage in talking to the politicians. We need action. We need everyone to participate in solving this problem.
Thank you, Ilham. So systemic barriers and the need for policy change, but also for sensitizing and advocating. Can I ask other SFN members to speak? And just to refresh, we had talked earlier before the SFN members came in about the social determinants of health and the ecological determinants of health, and how food access and food equity are centrally tied to both. I see that Nadira is here. Nadira, are you able to talk to the very important anti-racist and the culturally specific programs that East Scarborough Boys and Girls Club has been running? I don't know if your Wi-Fi is good enough.
Can you hear me, Jaita?
Yes, we can hear you very well. Thank you. Please speak.
Okay. So if you lose me, just text me and I'll repeat myself. So yes, we actually have multiple programs for children and youth within the range of 0 to 18 and also 21. So we have licensed childcare programs and youth programs where we're supporting them through our programs and indirectly by giving out backpacks packed with food, youth backpack programs. We also had a food support program for families, about 600 per week in the year 2020, 2021, during the peak of COVID time. And because our community, as you know, we are mostly all the members here from Scarborough, is very, very multicultural all over the world. So we make sure that we talk to our community members and our stakeholders and see what cultures or they're coming from, what they're comfortable with in terms of food, and also communication, because we have seniors, just Ilham is saying that we have immigrants who are not comfortable with the language. We try also to facilitate that. Now, in terms of diversity in food, we try to access our food from different suppliers, which is local businesses that are actually, have actually grown in Scarborough to keep up with their businesses, ordering through them so that they can manage their expenses and also stay afloat. We also look at religious requirements, allergies, food restrictions in our children and youth, and also we do surveys on their basic needs. For example, when we were doing the food support program, we mostly focused on the most expensive items, which is produce and dairy. As you know, it's very expensive in the market. We also looked at youth, where we actually provided cooking programs as well, and had virtual cooking programs, which actually saved them a lot of money, because if you know, you buy an English muffin breakfast sandwich for what, $1.80 something from Tim Hortons, but you can make it for 83 cents if you make it from home. So that is one thing we did. In terms of children, which is who are enrolled in our licensed childcare program and our before and after school program, we have a very, very diverse menu that caters to them, which includes items from all over the world. We have a kitchen that was built to cook from scratch. We also ensure that if there are any families who are struggling, that when we have excess inventory, we share that with our families. In terms of our struggles, we do struggle with funding. For example, licensed childcare program does have specific grants that are included within their budget for food, but not necessarily before and after school programs. So we struggle in funding with that. Our backpack program for youth has not started this year because we do not have any funding. We also have, so that is that. The cooking program also has not started because we do not have any funding. Unless the food budget is included in our programming, like licensed childcare, that is where we struggle a lot. The other thing that happened due to COVID is also the restrictions, the number of people who can come to the building, whether they're vaccinated or not. You also have to know that many of our students and youth actually have 2 or 3 jobs. They don't have time to meet up with vaccinations and come to a site and show their passports and get in and access that. We face that struggles as well. But we delivered whenever we could, if it was, because we also have staffing shortages at the same time. So those were our main struggles. So I hope I've covered everything. If there's anything missing, please let me know, Jaita.
Thank you, Nadira, for bearing such eloquent testimony to the day-to-day advocacy and the day-to-day, everyday important work that is being done by your organization, which matches up so well with what Suman and Debbie had told us earlier, but also the fact that, for instance, without a national school food policy, that it is organizations that have to struggle to apply those band-aids that someone was talking about, and their staff have to heroically keep applying for grants to keep those programs afloat. So that is where, again, the social determinants of health and the policy gaps are, again, vividly in view. On the ecological determinants, I do see that Green Access is that Access Alliance is here, I think. And also I saw Katie Fullerton of CD Saturdays, and I think I saw Jennifer Ford as well. So if, so the theme of this Collider event, to which SFN members agreed to come and talk about what their own networks have been doing connected to it, is food access and food equity, healthy food policy, and community collaborations towards nutritional security. So I invite other SFN members to speak. We have another 15 minutes or so, so please just speak up. Thank you.
Is it okay for me to go, Joe? Hi, everyone.
Yes, thank you so much, Imo. Yeah.
My name is Chimu, and I'm the Sustainable Living Coordinator at Access Alliance. Excuse me, I show up as Green Access, but I don't know how to change that, or it won't allow me to change it. So forgive that, please. So as I said, I'm from Access Alliance, and we are primarily a health center. So we provide primary healthcare services, including health promotion, illness prevention, treatment, and chronic disease management, but also individual and community capacity building. So I hope I can be heard by everybody. So primarily our goal is directed at people who face barriers to good health. And that includes, of course, food. And our primary audience or our primary base is immigrants and refugees. And so, I mean, I'm going to parrot a lot of what Ilham and Nadira have said. We face similar challenges and similar issues. Because, of course, our base is primarily immigrant and refugee based. Another additional issue is, of course, having language interpretation, so having that access piece that people actually can communicate with us. So a big part of our programs is the language portion. On top of that, again, just echoing what Nadira and Elham said, is that we have people who come from all over the world, and in addition to whatever health issues they may be having, there are the social, emotional issues that they're facing from the migration experience, and food is a part of that. Of course, and Ilham had spoken before about culturally appropriate food or food that the community seeks, whether it be halal or just specialty things, and making them available. We do have a Food with Dignity program, which is, I guess, our flagship food program. That's the flagship one, and then there are a lot of tangential ones attached to it. And Food with Dignity is what the name says, that people receive food, but also in ways that are not humiliating, that also address people's mental health and any stigmas around actually receiving food. So it's getting away from the soup kitchen aspect of it. And in addition to that, we also acknowledge that, of course, that housing, the money that people pay into housing, people who are on benefits, but also people who we deal with a lot are people who are undocumented. And that's another layer in terms of providing food access, because if people are undocumented, they're not necessarily receiving, whether it be on ODSP or Ontario Works, they're not necessarily recipients. And then there's the additional issue of, for those who have this issue and understand this issue, of giving people money or paying people who are undocumented. So that's another issue in terms of providing money that goes into food. There's also the another issue that we dealt with, because Joe had brought up the environmental issues around food, and we have a lot of our community members are also farm workers or previous farm workers, or came to Canada as farm workers, and we're also seeing the health impacts of that in terms of their previous experience, and then also their experience as farm workers in Canada. So it's not just pre-migration, but also in Canada, what their experiences of farm workers were and how that impacted their health. So I know that there's other people who want to go, so I'll finish there.
Thank you so much, Chimo. That was really important. Thank you so much for your insights. Can I ask the next SFN collaborator to go next? Jennifer, did you want to talk about how your markets have helped to really provide fresh and healthy foods in areas where there is a real challenge? And we had touched earlier, Jennifer, in fact, you may have, we had spoken about you and your markets, because we had talked about the Scarborough, Toronto Market Bucks program, and how, however, policy change and support is needed to be able to bring your markets, bring that to your markets, but also you have some new initiatives with farmers, Ontario farmers, to bring fresh foods to your markets. So we wondered if you could just very quickly tell our audience about it. Thank
you. Hi, good afternoon. Thanks, Professor Sharma. I think the most, I think with the Scarborough and Courtyard Farmers Market, I think we're gaining traction because we are trying to partner with groups that would be otherwise marginalized from participating in, the wider sphere. In light of this, we've been very fortunate to partner with Professor Sharma, Feeding the City, with Suman Roy, with different groups, the St. Andrew's Anglican Church, and most recently with Foodpreneur, which is a food incubator in the Toronto area. A few weeks ago, I was just explaining this with the call with Ilham before we got on this call. A few weeks ago, I would say about 2 months now, a vendor contacted me to ask if we could help revisit a night market that took place at the Mel Lastman Square. Subsequently, we have started getting that going in addition to the other markets. This relative to a vendor request, people are looking to work, people are looking to make money, people are looking to capitalize on, hopefully the pandemic is waning, and they want to get out there as, God's purpose. Yesterday, I received an email from the City of Toronto. I'm just stoked. Jacqueline Tam, who will be joining Professor Sharma and I on in a meeting on this Friday. But what is key to that, the city is now canvassing and trying to work and provide some supports for the establishment of night markets to help, bring up some activity and generate business revenue in the city. So they had contacted me in regards to that, and hopefully we can get the momentum going. I would like to hopefully, yes, open the market at Mel Lastman Square. Another site in the west to make sure we're covering the city as much as we can. And finally, beloved Scarborough Malvern. So stay tuned, and hopefully we could work to get these night initiatives going to just kick up the vibes in these neighborhoods. And that's it. Hope if you know of any vendors that are trying new food products, any vendors growing hopefully nutrient dense, culturally appropriate food that they're interested in bringing to market, that would be great. And I think that's it. So I think relative to the markets this year and where we're growing or where what we're trying to do, definitely create more partnerships and synergies with organic and non-sustainably grown food distributors. We've recently also partnered with Food Share and with Fennings Farm to continue that push and to hopefully capitalize on what we all hope for would be a great summer in the city. And some good vibes, some good reggae, some bhangra, whatever, let's hype it up and let's get it going and let's chill in the evening.
Thank you so much, Jennifer. Your markets are certainly doing a lot about food access to, of course, the systemic barriers that we talked about earlier in terms of food equity. And that is where something like the Scarborough Toronto Market Bucks program that I know you were working so hard with Suman and Marina Kirello to implement is still there, but that is something we need to put on the radar. And we had heard earlier from our student, Feeding City student researcher, Matilda DePieri, the research project she's doing that examines that program, that projected program side by side with what British Columbia nationally or more locally, the Junction farmers markets have been able to do. Is there anyone else from SFN who'd like to speak? Veronica, you had done some work earlier about the free local pantries. Did you want to quickly talk about that? And then Matilda is going to share something about another community collaborator who's not here today, the National Zakat Foundation, that would really, I think, match some of the points made about halal food access that Ilham and Nadira and Tinashi had already mentioned. Veronica?
Yeah, so Jennifer told me about the Toronto Little Free Pantries project, and I was able to connect her with them. Their slogan is give what you can, take what you need. And it started around the earlier stages of the pandemic to help combat food insecurity in local communities. And they make a point to say they're not there to replace food banks, but it's more of an emergency tool if someone really needs something. And they have a very active Facebook group of helping each other build pantries to put in front of their own house. And they even started where they have a map on their website and people can go and see all the little free pantries around Toronto and Scarborough. And we were able, I think, to put one little free pantry at the Courtyard Farmers Market around July, August.
Thank you, Veronica. I know SFN has to go back soon to their own meeting, but is there anyone else from SFN who'd like to quickly speak? Brian, we've already heard of some of the amazing work that CICS is doing from Tinashi, but is there anything you wanted to add? And we have Katie, we have Kyla, we have Ping. Anyone?
I'm sure Tanashi covered everything.
Okay, so I wanted to highlight actually another event where in fact we had Suman and others speaking, but including another community collaborator who has done very similar work to the Scarborough Food Network organizations and to the coalition, but they're actually also national like the coalition, and their local wings are more in the western part of the city. So that's the National Zakat Foundation. And again, referencing some of the things Suman had talked about, but also some of the points that came about cooking, for instance, or food knowledge. What they realized is that they appended the notion of like a food box, a food hamper, from food that came out of cans to food that you could cook. And so that is something, as well as the provision of halal meat to support specific culturally specific parts of the population. And again, in their case, they were an organization that worked with newcomers before the pandemic, but did not work on supplying food assistance. But this is where, when in the webinar Feeding City had held, where we had folks talking about food security, we had different organizations, including Feed Scarborough and NZF, talking about emergency responses in a diverse city. But I think this is where, more than a year on, where our conversation has perhaps evolved to talk about policy changes, not just the band-aids. And this is also where we can reference the important work done by scholars and activists on the notion of a basic income, and also about some of the policies that were stopped, and because of the pandemic, unfortunately, it doesn't look like some of them are coming back. But this is where we need to think about food access, but also food equity as tied to the social and ecological determinants of health together. So if no one from SFN does anyone want to have the closing word before we say goodbye? And thank you to the Scarborough Food Network. Okay, so I think we are now prepared to kind of start winding up, and I would invite our two remaining roundtable participants, Suman and Sarah, to perhaps have the last words.
Thank you, Professor Sharma. I think one of the last words that I would love to have is for us to all sit here and recognize that food is certainly a human right. And it is not only about nonprofit leaders or community members to tackle food insecurity. We are assisting the government in upholding something that the governments have signed up 50 years ago on food as a human right. So it is our time to actually hold our elected officials accountable and advocate for policy changes that's going to support food security in our communities.
I would only like to say, just to underline what we've heard today from people speaking, but specifically Debbie, Suman, and Tanashi, that food is about food care, and to borrow Suman's expression, in terms of health, food care, health. Food is healthy. Food is about ecology. Food is about education, culture, and so many policy solutions and program and grassroots solutions are happening right now. I mean, part of why we're here today is to talk about them and celebrate what people are doing in the city right now to address the many problems that we are facing socially right now in Toronto.
Thank you so much, everyone. I wanted to alert you that this is, of course, part of the wider symposium on health inequities in the Eastern GTA. And in fact, one of the challenges of this kind of format is that clashing with this timing of this food and health equities Collider event was another one on mental health. Then in the morning, there were a couple of other Collider events, including one which actually talked about migrants and undocumented new Canadians. And so I believe what the organizers will be doing, and Kim can correct me if I'm wrong, is to be sending recordings of the whole symposium, but also of the separate events. And we would definitely ask Veronica to post on the Scarborough Food Network's Facebook page. And we will be sending all of those for your own social media pages, for Sarah's lab, for the Feeding City lab, to share through the Culinaria networks and so on. And yes, you can post the SFN Zoom link in the chat. Thank you. But yes, I think anyone who has time right now is actually also welcome to join the SFN meeting, because SFN is posting their Zoom link. And meanwhile, at 3:30, the symposium will report back. So we will have a 5-minute summary facilitated by the notes that Neely and Matilda have taken. And if you had registered, you'll have received a link to the synthesis session, the 3:30 to 4 p.m. session from UTSC webinar tree, or if you did not get it, please email this address. So Veronica, thank you for sharing the link to the Scarborough Food Network monthly meeting. And you got the links earlier. So really, it's anyone who has either lives in Scarborough, works in Scarborough, has any interest in Scarborough issues. The network is a very open place. So just contact Veronica and then go to the links if you want to have more information about them. Okay, so thank you, SFN. We are really honored that people took time out of their normal meeting to be here. So yeah, I'm not sure there is anything, we can add to the really powerful sentiments that Suman gave us, but also to the way in which Sarah reminded us that, and I often find from these kinds of events that perhaps talking and figuring out our next steps is all we can do. So anyone from the audience? And thank you again, everyone, that in these busy, difficult times. And have a great afternoon, everyone. And I particularly want to thank Lee Slinger and the OVPRI team, as well as Kim and all the people who have been managing the various team and Zoom channels and so on. Thank you so much. And thank you again, Sarah, Suman, Veronica, Jennifer, Matilda, Tinashi, Anika, Adriana, Magdalena, all the people, Kim, Neely. Thank you so much. Bye.